Hello everyone, my name is M. Bhanushri from Geetanjali College of Pharmacy, currently in my second year of Pharmacy. Today I will be presenting on congenital heart disease. Congenital heart disease is a term that encompasses a variety of birth defects affecting the heart's normal functionality. The term congenital indicates that these conditions are present from birth. Congenital heart disease is among the most common birth defects, impacting nearly 1 in every 100 babies born. Congenital heart disease refers to a range of structural problems with the heart present at birth. These defects will prevent normal blood flow through the heart and can vary in severity. Congenital heart disease can be broadly categorized into two groups, cyanotic and acyanotic. Cyanotic congenital heart disease involves defect that reduces the amount of oxygen in the blood, often requiring surgical intervention. Examples include tetralogy of Fallot and transposition of the great arteries. Coming to the second one, acyanotic congenital heart disease includes defects that do not significantly affect blood oxygen levels but may still disrupt normal blood flow, such as ventricular septal defects and coagutation of the aorta. The prevalence of congenital heart disease has increased over the last century, stabilizing at approximately 9 per thousand live births. Annually, about 1.35 million newborns are affected globally. Making congenital heart disease a major health concern, it is also the leading cause of death from non-communicable disease in those under 20 years, with an estimated 270,000 deaths in 2019. The causes of congenital heart disease can be genetic or environmental. Factors include genetic mutations, chromosomal abnormalities, maternal illness during pregnancy, and exposure to the teratogens like drugs and alcohol. Risk factors for the congenital heart disease are excessive alcohol consumption during pregnancy, diabetes during pregnancy, genetic syndrome, certain medications used during pregnancy like lithium isotretinoin, as well as smoking while pregnant, rubella infection during pregnancy. Congenital heart disease results from a combination of genetic and environmental factors leading to abnormal heart development during embryogenesis. This can cause structural abnormalities and altered blood flow patterns, as well as resulting in clinical symptoms and long-term complications. Genetic and environmental factors include genetic mutation, chromosomal abnormalities, maternal illness, teratogens, abnormal heart development, week 3 to 8 of gestation, failure in septation such as atrial septal defects, ventricular septal defects, abnormalities in the valve formation, stenosis, atresia, incorrect vessel formation, transposition of the great arteries, tetralogy of Fallot. Structural abnormalities include defects in the heart chambers, abnormalities in the heart valves, malformations in the blood vessels. Hemodynamic changes includes altered blood flow patterns, increased or decreased pulmonary blood flow, shunting of blood. Clinical manifestations such as cyanosis, heart murmurs, failure to thrive, respiratory distress, fatigue, and poor feeding. Compensatory mechanisms such as cardiac hypertrophy, increased heart rate, polycythemia. Long-term consequences, heart failure, arrhythmias, pulmonary hypertension, endocarditis, etc. Symptoms of congenital heart disease may appear at birth or later in life and can include cyanosis, fatigue, heart murmurs, respiratory distress, and poor feeding or growth in infants. Diagnosis typically involves a physical exam, chest X-rays, electrocardiogram, echocardiogram, heart catheterization, and MRI. These tools help assess the heart structure and function. Treatment options for congenital heart disease vary based on the defect severity and can include catheter procedures, medications, non-surgical procedures, oxygen therapy, and surgery. In severe cases, a heart transplant may be necessary and also includes balloon valvuloplasty, arterial switch. Potential complications from congenital heart disease treatments include bleeding, infection, arrhythmia, scar tissue, blood clots, aneurysms, as well as heart attacks and leaky heart valves. Preventive measures during pregnancy include avoiding recreational drugs, smoking, alcohol, managing health conditions like diabetes, and staying up to date on vaccination. Regular screenings are crucial for early detection and management of congenital heart disease. For more information, please refer to the following sources: Mayo Clinic, American Heart Association, and Medline Plus. Thank you for your attention. I'm happy to answer any questions you may have. If you have any questions regarding congenital heart disease, you may ask in your comment box. Thank you.